Hi, I'm Anthony of the University of Pittsburgh, and in this video I'll be giving you a general overview of the total hip arthroplasty, also known as the total hip replacement. So what is a total hip replacement? It's a surgical procedure in which both the head of the femur and the hip socket, known as the acetabulum, are resurfaced with a prosthesis to improve joint function. This procedure is typically used to aid those with moderate to severe osteoarthritis return to prior levels of function and activity. Before your hip replacement, consult your doctor about conservative treatment. And if you are a good candidate for surgery, be sure to partake in prehab with a physical therapist to speed up recovery. Additionally, consider any lifestyle modifications that may be needed once you're home, such as a family member or friend to aid temporarily in daily tasks. Also, help may be needed if there are any stairs that you may need to navigate, and accommodations should be made. In many cases, people have to sleep on the first floor of their house temporarily until they're able to climb stairs. As with any surgery, there are potential risks involved, particularly with infection, blood clots, and nerve or blood vessel injury. Additional risks specific to hip replacement include a leg length discrepancy post-surgery and hip dislocation. However, a total hip replacement has an extremely high success rate. Now, what may you expect the day of surgery? Well, the replacement results in a short hospital stay, typically of only 2 to 4 days. Keep in mind that discomfort is normal and movement of the limb is encouraged as soon as possible, so don't be surprised to see your physical therapist shortly after surgery. Good news, however, much of the beginning exercises will feel easier and more familiar if you went through a bout of physical therapy prior to surgery. Not all movements are encouraged, unfortunately. The 3 things that should be avoided due to potential failure of your new joint are bringing the knee above the hip, rotating the foot inward, and crossing the leg past the midline of your body. These are general precautions, and the time frame of these restrictions may vary depending on your recovery. But what can you expect from your recovery? And what about your goals? Well, recovery usually continues for 9 to 12 months after surgery for the best outcome. It is a gradual, slow process and may be recommended to have both land and aquatic outpatient treatments. Physical therapists will help guide you back to normal daily life, and it can be expected for you to return to the activities you enjoyed prior to your surgery. Don't be afraid to let them know of any goals that you have in mind. Now to summarize, hip replacement is a relatively low-risk procedure, and you can expect to begin recovery shortly after surgery. It may take anywhere from 9 to 12 months for full recovery, and always consult your doctor with any questions or concerns that you may have. Thank you for your time, and good luck on a speedy recovery.